This is the module Understanding Eligibility Response in Minutes. In this video, we will explain the information displayed on the Eligibility Response 271 screen in Minutes for a subscriber. A subscriber is a member enrolled with Minnesota Healthcare Programs, or MHCP. If you are a new Minutes user, we recommend that you watch the Verifying Eligibility in Minutes video before continuing. We will start on the Eligibility Response 271 screen in Minutes. The first two tables contain the subscriber information, the date of service, subscriber ID, subscriber name, birth date, age, gender, and address. The next table contains the provider information and address, followed by trace information. The eligibility information for the subscriber starts at the header titled Major Programs and is organized into two sections in a bulleted list. The first section states that the subscriber is eligible for medical assistance, or MA. Their eligibility began October 1st, 2014, and there is no end date, which indicates that their MA coverage is currently active. Next is a list of service types that the subscriber is eligible for. The second section states that the subscriber is also eligible for Qualified Medicare Beneficiary Medical Assistance, or QM. This program covers Medicare coinsurance and deductibles only. Their eligibility began April 1st, 2015, and there is no end date, which shows this coverage is also active. Again, Minutes displays a list of service types after the QM eligibility. The next section is titled Prepaid Health Plan. This header is displayed regardless of if the subscriber is enrolled in one. In our example, the subscriber receives Minnesota Senior Care Plus, MSC Plus, or MA30 delivered through Blue Plus. This is an insurance program through a managed care organization, or MCO. The next header is titled Other Eligibility Information. Here we can find information such as special transportation needs, hospice stay, living arrangement, if applicable, county of residence, and a link to the healthcare programs and services overview section of the provider manual. In our example, the living arrangement displays code 80. This means the subscriber is living in the community. We also see the county of residence is 019, and the number is a hyperlink. If we want to see which county this is, we can click on the link and it will take us to an external page for Minnesota county codes. Referring to this web page, we see that this subscriber resides in Dakota County. Under the header titled Waivers, we can see this subscriber is eligible for a TBI waiver. If the subscriber was not on a waiver, the word None would appear beneath the header. Under the header Subscriber Responsibility Information, we will find information about spend-downs, copays, and family deductibles. Under the header Restricted Recipient Program, information will display if the subscriber is on the Minnesota Restricted Recipient Program, or MRRP. This program means that some members are required to receive the following services from specific providers: inpatient hospital, pharmacy, physician services, mental health, and outpatient. We recommend reviewing the Minnesota Restricted Recipient Program Manual section for exceptions or more information. In our example, the subscriber is only able to use Dr. Terry Smith, MD, for their physician services and nurse practitioner services. If you had questions about a referral or a referral form for your subscriber, you would contact MRRP at 651-431-2648 or 800-657-3674. The next header is Other Insurance. This section contains details we have on file about the subscriber's private health insurance or third-party liability. In this example, the subscriber has a health maintenance organization, or HMO, through Medica and pharmacy coverage through Illuma. The next header is titled Medicare. This contains the subscriber's Medicare ID and the start date of the coverage. Under the header titled Benefit Limits, we see which benefits the subscriber has used as of the current date of service. Now that you have learned how to read the eligibility response screen, you will be able to identify if a member has the appropriate MHCP coverage for the services you provide. The Department of Human Services offers various training opportunities, including other on-demand videos and online sessions. You can register for the online sessions by visiting the MHCP Enrolled Provider Training page on the DHS Provider website. Check the MHCP Provider News and Updates for announcements on changes to programs and information about new learning tutorials when they become available. Thank you.